Hello, my name is Emma Nye, and I'm a doctorate in athletic training student here at Indiana State University. I'm going to talk to you about the Niosh generic job stress questionnaire, which can be used by the clinician to screen for risk factors associated with mental health well-being in the military population, and specifically with the job of a sniper. So what this tool originally was for was not the military population, but there's certainly some modules within this very lengthy tool that the clinician can use. So the tool contains measures of 13 different job stressors, as well as a host of measures of individual distress and modifiers of the stress response, specifically job requirements, job satisfaction, mental demands, and other health information modules would be absolutely appropriate for this population. Specifically, mental demands, question 1 through 5. My job requires a great deal of concentration. I must keep my mind on my work at all times. I can take it easy and still get my work done. I can let my mind wander and still do the work. Now, we know that there is a host of pathologies that occur from the physical demands of this activity, like a clavicular fracture or thoracic outlet syndrome. But the clinician has to take a step back and evaluate the psychological aspect of the job, since it is very demanding. This population may be in the sniper position for 16, 18, 20 hours at a time without moving, but they have to concentrate the entire time. So using these modules to predict or red flag the potential problems is really important. Particularly, there was a study that screened for mental health problems among all service members in the military, and the results showed that 50% of military personnel were referred for a mental health reason, and 12 were diagnosed with a mental health problem. And obviously, because of this prevalence data, a screening tool evaluating mental demand is vital in an attempt to decrease the statistics I just mentioned. So this tool, although it does not have any studies done to evaluate the diagnostic accuracy, so no sensitivity specificity data, although the reliability was shown to be 0.65 to 0.90, which is promising, and it was a significant predictor of job dissatisfaction and role conflict. But when we talk about actual feasibility with a clinician, this tool is very good. The questionnaire is easy to read and understand. The only pitfall in terms of feasibility is that soldiers may be hesitant to disclose this type of information, particularly the job satisfaction and the mental demands of this assessment tool. Soldiers may perceive disclosing this type of information as mentally weak and may not take it as serious, which may have implications on their well-being. So the clinician needs to be aware of that. In terms of physical or financial resources, really all the clinician needs is the questionnaire with those specific modules I pointed out and a quiet space. So if the clinician takes a step back and evaluates the psychological aspect of the job demands of this activity, perhaps the clinician can cut down on the referrals and those above statistics that I mentioned. And this tool is very easy, very feasible, does not take much physical or financial resources, and has adequate reliability and validity.